Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we're talking about the non-systems. So as you recall, as we go through this podcast, we go through each of the systems that are represented on the FSBPT's most current content outline. And so as of 2024, the FSBPT has updated the content outline to reflect not only a reduction in the overall number of questions, but also the addition of what are called scenario-based items, where you are given a patient chart and you go through the content of that chart to answer several questions about it. So in the podcast format, we'll be going through primarily standalone questions. Again, just as you consider, in order to do a true scenario-based item, you have to be able to return back to the scenario and chart multiple times to find the key information contained therein. And in fact, that's one of the few times I encourage you to read the question backwards, meaning that you read the question and the answer options first before then really dissecting out the patient chart. Now, it doesn't mean you can't look at the patient charts, get a quick glance at it, but the purpose of looking at the actual question and the answers is to help narrow your focus so that then as you return back to the patient chart, you'll be able to have a clearer focus of what you're looking for and what the context is of your analysis of that of the patient chart, or what they call scenario-based items. So certainly that's worth doing. That's the other times that I suggest that you read a question backwards would be in the case of a video or an image item. So on test day, you can experience some video or images. Now, again, I would suggest that you look at the answer options first so that then it narrows your focus as you then dissect out the video or the image so you can more clearly see what it is that is precisely going on. So in any case, in this podcast, we go through the FSBPT content outline, one system at a time. Today is no different. We're going through the non-systems. This is related to professional responsibilities on the NPTE. So you can experience a good handful of questions on non-systems professional responsibilities. Now, the key with professional responsibilities, I'll give it to you now, and I'll talk about it again at the end. But the key with professional responsibilities is to make sure you have identified what is best for the 3 Ps, for the physical therapist, the patient, and the payer. So if you can make sure that all 3 of those are in a win-win-win situation, you'll find that that will lead you to the best answer almost categorically. All right, so with that, let's go ahead and dive into our practice question here for today. As per usual, I will read to you the item, give you a moment to respond, and then we'll talk about it together. A physical therapist is evaluating a patient that has been referred to receive physical therapy intervention. During the evaluation, the therapist identifies the presence of a neuromuscular condition that the therapist has never previously encountered and falls outside of the therapist's working knowledge. Which of the following steps is most appropriate for the therapist to complete next? Number 1, begin the course of treatment and consult with other clinical staff regarding treatment protocols. Number 2, discontinue skilled physical therapy intervention until the therapist has had adequate time to research the topic. 3, refer the patient to a physical therapist with the appropriate competence for the patient's condition. And 4, refer the patient to the physician for further medical intervention. So again, we have a therapist evaluating a patient that has been referred to receive physical therapy intervention. During the evaluation, the therapist identifies the presence of a neuromuscular condition that the therapist has never previously encountered and falls outside of the therapist's working knowledge. Which of the following steps is most appropriate for the therapist to complete next? Option 1, begin the course of treatment and consult with other clinical staff regarding treatment protocols. Number 2, discontinue skilled physical therapy intervention until the therapist has had adequate time to research the topic. 3, refer the patient to a physical therapist with the appropriate competence for the patient's condition. And 4, refer the patient to the physician for further medical intervention. So this question asking about your professional responsibilities related to your competence. So the correct answer is referring the patient to a physical therapist with the appropriate competence for the patient's condition. That is indeed the correct answer. This is part of the APTA's standard of practice for physical therapy, which indicates that it is the responsibility of the therapist to ensure that their level of expertise meets the patient's requirements, meets the patient's needs for core competence. Now, generally speaking, you will likely have sufficient competence with some exceptional cases you can think of, that if you are, let's say, you're 10 or 20 years into your practice and you've only ever treated orthopedic conditions, and then you get kind of out of left field, you get a condition or a patient with a condition that you either don't remember, you've never heard of, or you've never had any experience with, you'll find that your level of expertise and competence in the area is insufficient for that patient. And so it would behoove you to make an appropriate referral to a therapist with the appropriate level of competence. Now, that being said, one of the other standards of professional responsibility as PTs is to ever increase our competence. And certainly there can be some specialization and specialties involved here. But in this particular case, where we have a therapist that has a patient, the patient has a neuromuscular condition the therapist has never previously encountered and falls outside of their working knowledge, the most appropriate thing is to, number one, refer the patient out to a therapist with appropriate competence. Now, hopefully that would be someone, speaking in the ideal world, it would be someone local, someone you're acquainted with. However, that being said, you may have to do a little bit of research to find someone, a couple of phone calls, try to find someone with the appropriate level of competence, I should say. Now, these other incorrect answer options don't serve the patient very well. So option one, begin the course of treatment and consult with other medical staff regarding treatment protocols. Again, it's kind of a half-baked intervention. You want the patient to receive the adequate level of competence in order to treat their condition. And so if you take a wild guess at it and then just figure it out on the way, that tends to be a less than ideal situation for the patient. So other incorrect answer options would be to discontinue PT until the therapist has adequate time to research the topic. Now, ideally, you would indeed research the topic, but you would not want to delay care, especially for a patient that ostensibly they require care, which is why they are in your office doing an evaluation with you. So it would not be in the patient's best interest to delay intervention. And then finally, the last incorrect option is to refer the patient back to the physician for further medical intervention. Communication would be nice, and the chances are that a good phone call, again, with the physician will likely go a long ways to help the physician know where to refer patients with this particular condition. But generally speaking, though, you as a PT, you want to work directly with the patient. Most direct and effective care would be to make an appropriate referral to a physical therapist with the appropriate amount of competence and skill for the patient's condition. So all of that being said, correct answer here is refer the patient to a physical therapist with the appropriate competence for the patient's condition. Now, as I mentioned earlier, when it comes to these professional responsibilities questions, the key is just making sure that you have accounted for all of the stakeholders in the arrangement here, which it's usually the triple P. You've got the physician, the physical therapist, really any clinician, so physician or physical therapist. But in our case, the physical therapist, the patient, and the payer source, all three of those need to be satisfied in a win-win-win situation. You need to make sure that all of their interests are all aligned for the benefit of the patient. So the patient, the PT, and the payer source. If you can make sure that you do so, all three of those P's, you will answer all of these professional responsibilities correctly. And they can get a little bit convoluted if you look at some of the questions, but almost always it boils back down to, does the therapist have the adequate skills to treat? Does the patient actually require skilled intervention? And is the payer source being used appropriately? So we're talking insurance companies, really even a private payer. You want to make sure you are rendering necessary care, not unnecessary care. So you make sure all three of those are accounted for, and you'll find you will answer all of those questions correctly. All right, so we'll go ahead and bring today to a conclusion. Again, hope you check out all of the other episodes we've got on the podcast. Plus, if you haven't yet, it really just takes a moment. Go ahead and leave us a 5-star review over on Google Play, Apple iTunes, or Spotify. Wherever it is that you're listening to this podcast, it only takes just a moment. It really helps as we try to get the word out about the podcast. And yeah, we've got lots of great resources for you over at ptfinalexam.com. Be sure to check that all out. I'll catch you all in the next episode. Have a fabulous day, everyone. Will Crane fist pumps all around.